Morning, everybody. Welcome to our health forum. Just to announce, we are live. We're on Facebook and Seven Generations channel. All right, okay. Okay, we have our agenda today. We're going to start off with our welcoming remarks by our health director, Albert Jimmy.
Good morning. Niganaya. Ngas mago tawino. Kutakiska imigua mutatutama matsunnat. Matsunno. First of all, good morning. And I'd like to thank the Creator for giving us another day to walk our lives today. And I've been working so many years here, and once in a while, now and then, we talked about, putting a health form. We finally did it, but kind of disappointing. I think people raised their hands other than health staff. So we have 3. That's good. But at the same time, what Eugene said, it's on a live stream, will reach the other people out there. So I'm not disappointed that way. So it's nice to see the staff preparing for this event, and I really commend you. And hopefully, we'll do this every year at least, or even twice a year, and to reach the people out there, to give them, the information, what we do, and also to hear them out, what we need to improve. So with that, I'll let, the event start, I guess. Thank you.
Thank you, Albert, our health director. Hey, thank you very much. And just to put it out there, we do have a lot of door prizes to give away to the end tomorrow, but you have to be present here at the hall in order to win. And the ones that are here, you have to get a ticket in the back over there and a survey form. It'll be on a pink form like this. Fill it out, and you'll go around the booths, and you can also win that way. So like I said, you got to be present if you want to win door prizes. We have lots of good door prizes. I think at the end of the day, tomorrow we'll give away Oilers tickets, I think. All right, another announcement. We are going to be doing flu shots here at the New Round Hall. All right, so with that, we'll start the agenda here, and I will call Kelly Astum.
This one on. Oh, hi. Okay. Good morning, everyone. Can everyone hear me? Yes? Okay. That was a good response, guys. Okay, so my name is Kelly. I am the clinical nurse at the health center. I'm going to be teaching you guys about how we operate and how we run and kind of go over appointments and stuff like that. I've been working in this position. It'll be 11 years in December. So I'm really happy, even though I'm super nervous. I was really happy they chose me to present our clinic. Okay, so let's start. Oh, I'm in the way. Yeah, if you can click it for me, that'd be great. So click it. Okay, so this is where our front door is that most of you have known. Lately, or just recently at the end of September, we've been hearing people's, what would I say? We've been hearing a lot of people's concerns about getting appointments and stuff like that. So we've been meeting lately on how we can improve this. So one of our things is now that the doors won't open till 8:30. That gives the front desk some time to open up, turn on the phones, listen to voicemails, all that kind of stuff. So now we open at 8:30 till 4:30, and then we do same day appointments, our walk-in appointments, but we call them same day appointments. The list starts at 8:30 and then restarts again at 12:30. So this is our information on our active treatment. So like I said, same day appointments start at 8:30 and again at 12:30. Lots of people show up early, so I always suggest always come at 8 o'clock or 12 because there's usually quite a long line at the front door. So for booking appointments for each provider, we do 2 regular appointments in the morning and the afternoon. We do recall appointments as well, 2 in the morning and 2 in the afternoon. So that's 4 for each provider every morning. The recall appointments is when you had lab results, other, what do we call it? Follow-up, or like when another doctor sends over something that they want your family doctor to go over with you as well. We also, one thing we just started recently as well is we do elders requests, and that we do 1 appointment in the morning and in the afternoon. The booked appointments are seen as priority. So when you come in for your walk-in, we ask that you stay for the whole morning. So if there is a no-show, we'll fit you in where appropriate. So when it is time for the doctor to call you, you're there. But if a booked appointment does show up, you have to wait until their time slot's done for us to fit you in. Another thing we just started recently as well is, because we have Doctor in a Day now out in our clinic, we started prenatal days once a month. And then we also have our amazing diabetes team that now does diabetes day. And we also do that once a month as well. We've had a couple of those already, and they're running pretty good. So when booking an appointment, it's really important that we let the receptionist know if we need, what kind of an appointment we need. For example, long appointments. We need to allot the right appropriate time for you so you can get all the information. So these are the type of appointments that would need to have a longer appointment, about a half hour. Is pre-ops, SGI forms, or driver's medicals. Those make sure to bring your glasses and your driver's license with you, or we can't continue with the appointment and you'll have to reschedule. Social assistance forms, prenatals, infant checkups, postnatals, treatment forms, complete physical, procedures. Another one on there would be disability forms. A lot of these, so with our doctors, they're just true walk-in doctors. They're not your family doctor. So they have to sometimes go over all your history in your chart. So it does take longer for them because they don't know you personally. They don't see you all the time. So that's why we need to make sure you have the appropriate amount of time so that these are filled out correct and all the information they need to continue on with the appointment or the whatever else you might need this information for. Okay. So canceling and rescheduling appointments. We understand that life can be unpredictable and sometimes plans change. If you're unable to attend your scheduled medical appointment, we kindly ask that you let us know as soon as possible. Canceling or rescheduling in advance allows us to offer that appointment slot to another patient who may be in need of care. It also helps us run our clinic more efficiently and reduce waiting times for everyone. Whenever possible, please notify us at least 24 hours before your appointment. This small courtesy goes a long way in helping us provide timely and effective care to all of our patients. Your appointment matters, so please let us know if you need to cancel or reschedule. And click it one more time. So, just a little tidbit is, in the month of September, we calculated that we are open for 20 days, and we had 135 no-shows. So when we have no-shows, and I have to admit, I get scared and shy to call clinics to say I'm not coming. But now that I work at work and see how many no-shows we get, it is very important, especially when we have people showing up and wanting to come in for a walk-in or need something urgently done, and our lists are full with these appointments. For example, earlier when I showed, like, we usually book about 5 in the morning already, so that only allows so much time for walk-ins that day. So that's why it's very important that when you do call, we can at least let another walk-in come through, or someone that else has been asking, calling. Like, we have people calling every single day trying to get in, and we try to accommodate as best we can. But when, like yesterday afternoon, Dr. O's list had 2 people show up in the afternoon, the rest were all no-shows. And we had to turn a couple of people away in the afternoon because those people had booked appointments. Another thing we're trying to do to avoid this when we had that meeting is we're going to start calling to remind people of their appointments as well. And another thing we have at the clinic, which I actually forgot to post up here, is we actually have a clinic cell phone that we can also, we understand sometimes people don't have minutes, numbers change. So you can also text that number, or we can text you and you just let us know, like, hey, just text me or get a hold of this person, just to help with that communication with you and the clinic, so we can all just run smooth. So when you're checking into your appointment, we want to ensure that all your information is properly up to date. This also helps, like, when we send out requisitions or we send out referrals to specialists, we want to make sure all your information is properly updated. So when they call the phone number, it's the right phone number on there. Let's say if they have to mail an appointment notice, it's going to the right appointment. So it's always really good that we have your correct information. Another thing we run into sometimes is the health card. It's okay that you don't have it with you with every appointment, but you do need to bring it, and I suggest you do try to bring it when you can, because we need to make sure the number's up to date, and what's on your card is what we have to put on there so that you get coverage through Sask Health as well. Another thing we do as well, so these are things, so birthday, health card, address and house number. That's another one. For house number, it's good for us to have, because if your number is out of service and let's say your next of kin or anything else on there is out of service, we have people in the clinic that can go to your house and also inform you in person about an appointment or something else that might be urgent that we need to get a hold of you with. And next of kin, okay. So these are doctors and nurses right now. This is our weekly schedule on how we operate. For Mondays, we have Dr. AJ and Naday. He is just in the mornings on Monday. And then we have Jessica. Tuesdays, we have Naday as well, Dr. O and Jessica. Wednesdays is Dr. Febbles, Dr. Bio. She's new. She just started in September. And Jessica, Thursday, we have Dr. Naday, Dr. O, and Jessica. And then Fridays, AJ and Dr. Naday. So the clinic has 1 nurse practitioner, 5 visiting doctors from Lloydminster that rotate throughout the week. We have a clinical nurse coordinator, that's Jackie Locke. She's currently off right now. And then clinical nurse, that's me. And we currently do not have our full-time provider that, for example, if you guys remember Dr. Letty, that was one of our full-time providers that was here 5 days a week. But right now we don't have anyone. So this is our fun one. So this is our get to know our providers. So our first one is we call him Febbles, but his actual name is Dr. Labrador Febbles. He's actually an anesthesiologist at the Lloydminster Hospital, and he's the one that comes out here on Wednesdays. Dr. AJ, the second one down, he's also a family physician at Border City Clinic, but he comes out here on Mondays and Fridays. And then we have our new doctor, Dr. Bio. She's a family physician, and she covers at the Lloydminster Hospital, sometimes in emergency as well. This is Dr. O. She is a family physician at Prairie North, and she comes out on Tuesdays and Thursdays. And then this is Dr. Naday, an OBGYN and family physician at the Lloydminster Clinic. And then there's Jessica. Jessica Harper is our nurse practitioner at the clinic here. So understanding emergencies. We get a lot of people in here that show up at the clinic that say what is happening is an emergency, and sometimes it is. Sometimes it's something that's more than what we can treat or accommodate for someone. So an emergency is defined as a serious, unexpected, and often dangerous situation that requires immediate medical attention. So some examples are chest pain, stroke symptoms, severe infections, and someone with difficulty breathing or shortness of breath. Our clinic is equipped to handle minor urgent medical needs. So these are lacerations, so cuts. A lot of times we get kids that will fall, or let's say you're fencing and a barbed wire gets you, something like that. That's just a cut that we could treat. The sooner you get in, the better. Animal bites, minor fractures, no bones through the skin, and a lot of the time, if it's a child, sometimes we do have to send it to the city so the pediatrician could see them. So we could start the visit, but normally we have to send those guys out if it's a more complex break. And also blood pressure concerns. So if you have high blood pressure, your chest is feeling funny and you can come in and ask for the nurse, me, or Jackie to do your blood pressure, and we can check it. And if it's something that we're concerned about or uncomfortable with you leaving the clinic, then we can squeeze you in to see the doctor. If a patient presents with any of the following, we will need to call an ambulance for an emergency transfer, because we need to remember we are just a clinic. We're not an emergency department, so we don't have the proper pain meds or diagnostics or anything, which I did write on here, I think. Inability to walk or move without assistance. We don't have any proper lifts or anything as well, so if you are unable to walk or ambulate, then you need to go to the hospital. We're unable to control your pain. We have Advil and Tylenol at the clinic, and it depends if the pharmacy's open and what they have for narcotics. But other than that, we can't give any more there. And if you need to see a specialist, so for example, like I said, for the peds, if they were to do a break that's more complex, we have to usually send them out so they can go see a specialist. Oh, and if you need to be monitored for 24 hours, we're limited on space. We've had emergency in the treatment room and an emergency in another office. So if you need to be monitored 24/7, that's another reason we need to send out, because we're just limited in space and staff. And please note, we are not an emergency department. There's me. Okay, what does a clinical nurse do? So this is what I do. The active treatment has two nurses, the LPN, which is me, and then the clinical nurse coordinator. I can check your blood pressure, height, weight, and blood sugar. If you come in, you can ask anytime. Sometimes there might be a little bit of a wait because there is just me, but I usually try to get to you as soon as I can, and if it slips my mind, the front desk is really good at reminding me that you are sitting and waiting there for me. Dressing changes, we can do those, but we need a physician order. So for example, if you come from the hospital or Elk Point or another doctor that they told you to come to us to get a dressing change, we need an order from that doctor before we can actually touch you. And that also goes with injections. We can also do injections for you, but we need the order from the doctor that prescribed it for you to do the injection as well. And then we just keep it on your chart. We just need it for that one time. I also help the providers in the treatment room with so like I said, the laceration, the castings, anything like that, I assist them. Always say I'm their third and fourth hand and grab them stuff as they need when they're in the middle of something. And also, so I always see you before you see the doctor. Well, I try to, because like I said, there's only me, so sometimes I can't and I'll send them back, but I'll just try to see all the patients before they see the doctor. So in doing that, I'm assessing and getting all the appropriate information you need for your visit, but I also will triage. So if someone comes in and let's say their blood pressure's through the roof and there's 3 other patients ahead of them, I'm gonna jump that patient higher than the other ones just because they need to be seen now, just so we can deal with what's going on. Okay. Oh, and then we can't go back. Can we go back? Okay, and then this is, Jackie's been off for a bit, so I don't have a picture of me and her or a picture of her recently at the clinic in her position, but this is just us. A while ago, we did a mock and emergency at the ambulance bay, and it just happened that Jessica was with us there. So that's Jackie. That's our clinic nurse coordinator. So this is our pharmacy. We have 2 pharmacists there. We have Jamie and Justin, and then we have a pharmacist assistant, that's Tash. Click again. So they're open from 9:30 to 4:30, Monday to Friday. They're closed on weekends and holidays. You can get your prescription faxed to them, or take it in. They can sometimes also, if you can't get in to see the clinic, they can also prescribe as well certain medications just to help with the clinic as well. So example would be like lice treatments, sometimes with bladder infections, other little medications as well. This is our lab and x-ray. You can click 1, 2, 4 more times. So in order to see the lab, to get an x-ray or to get blood work or anything, you need to see a physician or the nurse practitioner prior, just because they'll order what they think sees fit for you for what you need at the time. So you can click 2 more times. So before you see them, you need to see the doctor. They'll give you a paper, which is the requisition. This is a picture of what our requisitions, some of our requisitions look like. They'll give that to you to give to the clinic. Sorry, to give to the lab. Lab cannot give you your blood results. If anything, you need to book a follow-up appointment 5 to 7 days later at the front desk. If something were to come up abnormal or urgent, then we would call you to come in sooner, follow up with those results. Next is our Onion Lake ultrasound. So this is something too that has just been new in the last year, I think. It's over behind the front desk, so you come to the clinic. They're open on Wednesdays, so today. And then click again. So with this, you also, same thing like lab, you need to see the doctor to get the requisition so that they can send to them. So that's what their requisitions look like. So the doctor will fill that out and then fax it to them, and then they'll call you. That's why this is important to update your information all the time, and why we ask for your birthday and address, because that is put into this requisition, and then that's the number they'll call to book your appointment. If that number isn't updated, they'll cancel it eventually after 3 tries of trying to get a hold of you, and then you'll have to restart the process of getting re-referred. And that's it. Any questions? No? Okay, awesome. Thank you.
If somebody has a question, raise your hand, and we have a guy with a mic over here that'll bring you a mic. I can't hear you. Where's the mic?
Where's your guys' closest emergency hospital?
So a lot of people go to the Lloydminster Hospital, and then also people here go to Elk Point Hospital. The only thing, I hear great things about Elk Point, I love Elk Point. The only thing that is hard with the Elk Point is that they're Alberta and we're technically Saskatchewan. So whatever labs or anything they do, we don't have access to because they're Alberta. Versus if it was in Saskatchewan, we might be able to pull it up and see if we can get some lab results or anything that weren't directly sent to us. But yeah, so usually when people say they're gonna go to Elk Point, I usually tell them, make sure to see if you can get your lab results sent here, or if you have to get, like if it's a bad infection or something like that, I'll say, can you get them to send their orders here so that we can treat it as well.
You answered my question. But I did want to mention also, I know she would not say it, but the front staff, I just want to remind people to be kind and patient with them. They get a lot of feedback that's not always positive, and they do a lot of work to try to make things run smoothly. So we know you work hard. Carmi and Cheryl and everyone else.
Hello? Am I on? Oh, okay. Yeah, no, thanks, Alicia. Yeah, we do actually get quite a bit of criticism and feedback, and sometimes it isn't the nicest way of expressing your feelings. But we do try our best to accommodate. We do try our best to make everyone happy. The front desk is good at trying to fit who they can, going to the provider's door and asking if we can add more. But yeah, the kindness goes a long way. Another thing that we're implementing now is that if we start to get verbal abuse, we'll just have to either tell you to come back tomorrow or say sorry. Maybe just go do some self-care, calm down, take a walk, and come back, because we're trying to help you, and it's really hard when you're not being the nicest person to us. But if it ever does get to that point as well, we have a policy and signs up in place that state that we will call the RCMP, unfortunately, even though we don't want to. We do want to help you and try to fit you in and accommodate what you need at that time. But yeah, it does go a long way, and the front desk girls do try to do a lot to get you in and fit you in. So yeah, that's a good point, Alicia. Thank you. Anything else? Oh, there's one in the back.
So with you guys confirming appointments now, is there a certain amount of attempts that you try to call someone and get a hold of them to confirm their appointment? And then are you canceling that appointment to open it up for someone else if the person is not confirming that they're coming?
So usually they try to do at least 3 attempts. We do have like a little notification spot on that column there, so we can say like called, no answered, called, left a message, all that. But normally we won't cancel your appointment, because sometimes, like I said, numbers change, things happen, so, or they're shy, I don't know. But sometimes they do show up when we've called them, so we actually can't just cancel your appointment. We just have to go with a no-show if you don't show up, but we can see you didn't show up. So if you come and yell at me, I'll be like, hey. Any other question or anything? Okay, good. Thank you, guys.
Thank you, Kelly. Hi, hi. All right, before we get back on the agenda, this is for the people out there listening live. Like I said, we have lots of door prizes to give away. Like I say, tomorrow we're going to be giving away Oilers tickets. We have gas vouchers from the mall, I think $50 each. And we're also going to be feeding you soup and bannock today. So make your way down here. Like I said, the only way to win is be here. Thank you. All right, so next on our agenda, diabetes. And we'll be calling up Tanya Conacher.
Okay, can you hear us? Is it muffled? Just kidding. All right, so for the diabetes team in Onion Lake, there's Tanya Conacher. She's our diabetes nurse educator. She's the bigwig, the main go-to girl. And then there's myself, Alicia Oliver. I'm one of the dietitians and a diabetes educator. And then we have Ashley DeBuscher, who is another dietitian and certified diabetes educator. So we wanted to present today on sort of the current situation about diabetes in Onion Lake, but also just some basic facts. And then we'll share a research project that we did in Onion Lake with some of the youth. I think you're up first. Okay, wait, before we start, we'll warn you, we kind of jump all over the place.
We
So
interrupt
just-
each other a lot.
Yeah.
It's the way we do things. You better come over here, Ashley, so you can get in on the
Yeah.
interruptions.
Otherwise, you'll go in front of the, yeah, there we go.
So I'm not as familiar with these slides because we redid them after 20 years. But diabetes is a medical condition that causes sugar to build up in the blood. Forgive me if I jump to the next slide. But what that means, I think, is that once we eat, sugar builds up in the blood, and then it needs insulin, which is made by the pancreas, in order to move the sugar into the cells where it can be used for energy or stored for later.
Okay. Okay, so there's a bunch of different types of diabetes. There's three main ones that we see here in Onion Lake, and so that would be type 1, type 2, and gestational diabetes. Type 1 diabetes, this is usually diagnosed in children, but you can be diagnosed with type 1, I think anywhere up to 30 years old, which is terrifying as somebody who's 29. It could still, no, I'm just kidding, but it could still happen, right? This is something, it's usually diagnosed in childhood. The body does not make insulin at all. So the pancreas, the cells in the pancreas are not producing insulin at all. As soon as type 1 diabetes is identified, they have to be on insulin for life. So that's, insulin is the injection, the needle. It's a medication. This one is like a little bit more rare. It's not often seen in Onion Lake, but that being said, we definitely do also have some type 1 diabetics in Onion Lake as well. The second one here is type 2 diabetes. So this is one, it usually is diagnosed in adulthood, although we are seeing more and more cases of children diagnosed with type 2 diabetes. This is another situation where the body is just not using insulin properly. It can be managed with a couple different options. So with diet, exercise, there's oral medications, and then also injectable medications, and also insulin as well. So we see lots of type 2 diabetes in Onion Lake. We're seeing a rise of this in youth in Onion Lake as well. Our last type here is gestational diabetes. This is a type of diabetes that only occurs during pregnancy. So during pregnancy, hormones are all over the place. They're really wonky, and that can create situations where a woman will get diabetes just during her pregnancy. Usually after she's had her baby, her levels will kind of level out and go back to normal. So generally it goes away once she's had her baby, but it does increase the risk of having diabetes after pregnancy as well. So that would be like a type 2 diabetes once she's had her baby. It also increases the risk of her children having diabetes and getting diabetes earlier in their life as well, and having complications. Yeah.
Does that say die?
Oh,
We missed a T. Tanya, did you delete that? Okay. So ways, oh, is it? Okay. So ways to control blood sugars. There's three main ways that we see that help people keep their blood sugar under control. So the first and foremost would be diet. I think it's the first step a lot of times when people are told they have high sugars. If someone has what we call pre-diabetes, where they haven't fully developed type 2, but we're seeing early signs of their bodies not putting the sugar away properly, people are referred to Ashley or I for counseling around diet. People have a negative sort of thought about diets. We're not talking fad diets, we're talking about it's the way we eat in general. That's what diet means when we talk about that. So there's no special diet, it's just watching portions and things like that. So balanced plates, including protein, fiber, small amounts of healthy fat, and then small amounts of carb or carbohydrate. And then the second one, and this is more commonly when people have already developed type 2, you would see them on medications. So oral medications like metformin's are first line. Tanya will talk about that in a little bit. There's also injectable medications like insulin and others that you've heard of like Ozempic, but Ozempic is not insulin. It is a hormone type substance, but it's different. It's a gut hormone. So it's different than insulin that comes from the pancreas. So if you see someone on Ozempic, it's sometimes just it is just a weekly injection. So two of the stomach hormones that they now have available are GLP-1 and GIP. Tanya will talk more about that in a second. And the third is physical activity. This doesn't mean you have to run a marathon, but just being more active in general, daily tasks of living, like just doing laundry, things like that count and help bring your sugars down as well. Kelly, sorry. All right, you want to talk about that?
Okay. So a healthy diet should be a balanced with proteins and small amounts of heart healthy fats. So when we say proteins, that's this section up here, this one, on the Canada Food Guide. I'm hoping by now everybody's seen the Canada Food Guide. If not, we should probably put up some big posters around too. So proteins, that would be your meats, nuts, seeds, beans, legumes, fish, eggs, even yogurt and cheese. Those would all be sources of protein. And our bodies need them to maintain strong muscles. And it also helps to balance out our blood sugars as well. For heart healthy fats, so there's, we see a lot of heart disease across Saskatchewan in general. We need to focus on making sure we're getting enough heart healthy fats in our diet. So in general, when it comes to fats, like the more liquid it is, the better. Liquid's just easier on our heart to move throughout our body. So that would be things like olive oil, canola oil. There's heart healthy fats that are in fish, nuts, seeds, things like that. In general, we want our diets to be like nutrient dense. So that would be like right full of vitamins and minerals and fiber and protein and different things like that. Full of nutrients and full of variety as well. So eating a bunch of different types of foods each day. We don't, sometimes you can get kind of stuck and you eat the same things every day, and that can like over time contribute to like deficiencies or even like overload, so overdoing it on certain foods, right? We want our diets to be lower in empty calorie foods, so the foods that are high in calories but don't really give us much nutrients. So examples of that would be like pop. It's got lots of sugar. It's probably mostly sugar, maybe some caffeine too, but it doesn't really, it doesn't give us any vitamins, no minerals. You're not getting any good stuff out of pop, right? Same could be said for chips or candy. They're high in calories, but they don't give us a bunch of the good stuff that our bodies need. I think that right now there's kind of a push. Everybody's sort of focused and dialed in on protein, or I hear lots about protein. I hear it in kids that I'm coaching. I hear it amongst my friends. Protein is a big focus. You'll see there's Tim Hortons now has protein lattes, there's protein drinks at Starbucks, things like that. But one thing I feel like we're not stressing enough about as a society is fiber. So fiber, this is a part of kind of all of our plant foods, so whole grains, fruits, and vegetables. This is what it takes our body. It makes it longer to break down in our stomachs. It keeps us fuller longer. It's really good for our blood sugars. We need it, and this should be more of a focus. I think right now we're focused on protein, which is awesome. We should also be focusing on fiber.
I made that slide and I forgot a very important part. We forgot to mention carbohydrate. So carbohydrate is one of the macronutrients that produces sugar in our bodies. So when you eat carbohydrate foods, it goes in, breaks down into sugar. So those categories would be starch, so any grains, potatoes and corn are considered starch as well. And then fruits, any kind of fruit. So berries have higher fiber, so fiber is found in fruit like she mentioned, and if you eat berries, you can have more of them. You'll get the same amount of sugar as, say, one small orange. And then the third group is milk. Anyone lactose intolerant? Everyone puts their hands up. So lactose is actually a sugar, and so it's galactose and glucose combined. What happens is when you can't break that down, you don't have the enzyme to split them. Your body pulls in water and you get gas because the bacteria start to eat away at that sugar, and then you get rid of it in a way that I won't say out loud. But that's what causes lactose intolerance and people getting sick from it. So even if something's lactose free, it still contains sugar making properties, I guess. So milk products. The only one that doesn't break down into sugar is hard block cheese.
Okay, so common medications, and bear with me because I'm actually gonna go into more detail than I thought, but I thought I would do that because a lot of people ask me, how come there's so many? Why do I have to be on so many? It seems like a lot. So hopefully by going through them slowly, you will understand the reason why we suggest a few. So almost everyone has heard of metformin. It's usually what we would consider as first line because it's been around for years and years and it's very, very safe. It decreases the amount of glucose or sugar that is produced in the liver, and it also improves the sensitivity to insulin, which means that the sugar is able to get into the muscle and fat cells easier so that we have energy. There is a type of pill called gliclazide. It stimulates or pokes the pancreas to release more insulin. So it is effective for people who are still making insulin, but we call one piece of type 2 diabetes is called pancreas poop out. So it means our pancreas is getting tired. So these meds, when they're constantly poking the pancreas to make more insulin, we feel like it could tire the pancreas out over time. So now that we have a lot more medication choices in this day and age, we do actually not recommend it for the long term for most part. Then there are types of pills called Flozins, and a lot of people come in and they don't know what they're on, and there's all these fancy names, and that's okay. But so there's Forxiga, but then the Latin name is dapagliflozin, Jardiance, empagliflozin. So that's how we know what type of medication class as a health provider that fits in. These belong to a class called SGLT2 inhibitors, and they help keep your sugar low by causing the kidneys to remove sugar through pee or urine. So our kidneys are normally taught to clean our blood, pee out what's toxic, keep in what is good, and for the most part, our kidney recognizes sugar as our source of energy, so it is good. But if the sugar builds up so high, it causes extra pressure on our kidneys. It makes extra work for our heart to pump that same blood around, and so our kidneys will try to flush it out a little quicker. Then there's the gliptins, the DPP-4 inhibitors. They're a class of medications belonging to the incretin hormone, which is a tummy or gut hormone, and they help increase insulin after meals and decrease the amount of sugar produced by the liver. And some of the common names are Tradjenta, Onglyza, Januvia, and then all their Latin names with gliptin in there, so that's the gliptins. And then insulin, it's produced by the pancreas, and it helps move the sugar out of the blood for energy. And if you don't have enough, then we will supplement to bring your levels up. We have two types for the most part. That is a basal or a background insulin. Usually it's taken once a day, but there is exceptions. There's older ones called Humulin N and Novolin N. They're sometimes used in pregnancy, and those are actually twice a day. More common is Lantus, Toujeo, Basaglar. They're taken once a day at night. And then there's Tresiba that can be taken once a day, any time of day. And now Health Canada has recently approved a new insulin called Weekly, and it's once a week. So it is very exciting to some people, but most of the plans aren't covering this yet, so it's not quite yet there for us, but we're hoping soon. It might offer some flexibility to some families where maybe they have an elderly person that aren't comfortable taking their own injections, so a family member can come in once a week and supplement for them by only having to do that once a week. And then we have rapid insulin, and it is usually taken 3 times a day with a meal. We recommend 15 minutes before, but it can be up to 15 minutes after. And those common ones are Humalog, NovoRapid, Amdalog. There are others like Christie and other ones, but we're not seeing them here as much. And then there's Fiasp, which is really ultra-acting rapid, and it is often not used here as well, and it's coverage concerns. And then these are the ones the Kardashians made popular. They're the ones that everybody's interested in, and they are the tides. They are GLP-1 and GIP hormones that Alicia already talked about, and I'm probably going to get tongue-tied, but it's glucagon-like peptide and gastric inhibitory polypeptide. And they're both tummy hormones in the gut, and they control sugars by telling the liver not to produce any extra sugar or let it out during or right before a meal, so that we're not, because our liver will often let more sugar out And it tells the pancreas to get ready to make the insulin to match the spike from the sugar to bring it back down again. And it slows down how fast the gut will absorb the sugar at one time, so that it's just absorbing it, but nice and easy and slow. And it tells the brain you're full. So the names on the street are Ozempic, but it's called semaglutide. And then there's Mounjaro, and it's called tirzepatide. And these meds actually protect us in 3 different ways. They protect our heart, they control our sugar, and they can help control weight. And then the more purpose of this presentation is diabetes, but because obesity can be a risk factor for diabetes, there are 2 other newer medications, but they're the same Latin name, so they're still the tides, but they have different street names, and they're called Zepbound and Wegovy, and those ones are indicated for weight loss alone. Okay, this is a busy slide, but I wanted to just show, like, so many times I get asked, how come I have to be on so many pills? This seems like a lot. And back in the day, we used to really max one out and then max the next one out and wait till we kind of expired all our resources. And often if we have high doses of one medication, we end up with more symptoms than if we have low doses of other medications working on different parts of the body. So what should happen if everything was working as it should, we would eat something like an apple, our stomach would break it down into sugar, it would go into our intestine where our GLP-1 hormone would be released. It would do that job of telling the liver not to let out extra sugar, tell the pancreas get ready to make insulin, slow down how fast the bowel absorbs the sugar, tell the brain it's full. Then the sugar would get into the blood, the pancreas would make insulin, the insulin would unlock the cells for the muscle and fat cells where the sugar needed to go so that we have energy. And then in the background, there'd be our kidneys, and they would continue cleaning our blood, peeing out what's toxic, keeping in the sugar. But if our kidneys, the sugar goes over 10 to 12, then our kidneys will naturally try to pee it out. And that's where those Flozins, they help to just say, let it go, let it go. The metformin shuts off the liver, but also makes it's like nature's WD-40. So if you're opening the cell door a lot to get the insulin in, then that makes, it's the same as if you had rust on a cell or on a gate. If you open it a lot, it opens easier, and that's how metformin works. And then, all these gut ones. So before, there's not as many people on these ones, but before we had pills called DPP-4s, they keep your body's normal GLP-1 active a little longer in the blood. But what we've found out is that when people are diagnosed, GLP-1 levels are sitting at 50%. They're only making half as much as they used to. So then Ozempic and Mounjaro, they boost those levels up. And then a fun fact is, they're thinking now every 10 years that you've had diabetes, that GLP-1 reduces by a further 50%. Okay, Alicia doesn't think that's a fun fact. I think I covered this slide well enough, but I'll hand it over to Alicia if I missed anything.
I don't think so. I just think it's a really great way to show how all the medications work on different parts of the body. So when people are on multiple medications that are oral, it doesn't mean they have worse diabetes. It just means they're managing better sometimes because it keeps their sugar under better control, if that makes sense. Sometimes we see people on insulin as well as oral medications. So they do both, depending on what their sugars are at. She doesn't know what this one is. Okay, so physical activity could look like a few different things. So I mentioned a bit earlier, common daily tasks of everyday living. So doing laundry, that kind of thing. So that should be the base of our pyramid of activity in a day. Next would be trying to plan some more moderate activity. So they say 150 minutes a week of moderate activity, like going for, quick-paced walking, jogging, swimming, sports of any kind, like hockey, baseball, stuff like that. And then as well, strength and balance. So not forgetting to build up the muscles that we have. When you use your muscles, I actually brought resistance bands. If anyone's interested in taking some home, we can cut you a piece. But what they do is they're kind of like weights, but you use them to work your muscles. When we do that and someone has diabetes, it helps those cells open up the door to bring the sugar inside for energy. So it's not floating around in the blood. So if someone has a high sugar, they could try doing some of those even on the couch and like just sitting there and stretching with it, and that'll help their sugar come down a bit. Or go for a short walk. And then balance activities are really important to prevent falls. And I know home care, that might be more of a concern in their area, but it's really important to try to do balance activities. And then inactivity is what we want to limit. So screen time, watching TV, all the things where we're just sitting. So try to get in the habit of getting up and moving every 20 minutes or so.
So I'm sure you've seen a lot of these examples in the community, but there are different ways to monitor the sugar. The first one is a regular blood glucose monitor. So you prick your finger, take a drop of blood, and it gives you a reading. That's always going to be gold star. If you're ever in doubt, we say get your meter out and you check by blood, because that's the best. Then there is the Libra. It goes on the back of the arm. And if you're using a cell phone, it is a continuous glucose meter. But if you're using a reader, then you have to scan to get your results more often. And then the Dexcom, also on the back of your arm, is a continuous glucose monitor. They have little differences. The Libra lasts 14 days, the Dexcom 10. The Dexcom can show urgent low soon. So it's probably a better meter for prenatal women and children.
Okay, so we just did this slide at the school. But I think this is still relevant. So there's kind of two main conditions with diabetes that we'd be kind of worried about. We want sugars to be right in that normal safe zone. They might fluctuate a little bit with meals, they'll rise a little bit, and they'll fall a little bit with like physical activity or like breaks between meals. We want to keep people out of these two zones. So we don't want your sugars to be too high or too low. High blood sugars can happen when in circumstances where you might be eating more than you planned or eating differently. So let's say like you come to work, you've got your lunch, but surprise, your boss brought in pizza or something. So that might be like eating something different or more. They can also happen from skipping medications. So if you run out the door before you take your meds in the morning, then you might end up with high blood sugars throughout the day if you have diabetes. Stress can also cause sugars to rise. So like being in really stressful situations. Same thing goes with like infections or any kind of illnesses. So if you've got like a sore throat forming or starting up, that could cause your sugars to rise a little bit if you have diabetes. Same thing would be like drinking sugary drinks, especially if that would be like out of your ordinary. If we've got a wonderful sugar display back here, if you want to come take a peek. But if you like randomly stopped on your way home and drank a double gulp, and you are somebody who doesn't usually drink pop or something, that would cause your sugars to rise. So feeling sick, that can cause your sugars to go high. And then also just being like less active than normal. So if you normally say go for a lunch on your walk hour and you skip it that day, you might find that your sugars are a little bit on the higher end that evening. Okay, and then the other side of this would be low blood sugars. So we worry about both sides. Both sides can be really damaging. Both sides, if your sugars are really high, you might end up needing like immediate medical attention. Same with if your blood sugars go really low, you might end up, either needing to go to the hospital or But so low blood sugars are the opposite. This can happen if you eat less than you planned. Like let's say you get really busy and you have to skip lunch. You work right through your lunch and then suddenly you look at your clock and it's 3 p.m. and you didn't eat anything. Your sugars are like could be going kind of low even if you don't have diabetes too. Same with like eating later than normal. So maybe your car breaks down on your way to supper that night and you don't end up eating your supper until 8 p.m. Also skipping snacks and meals or doing more activity than expected. Like we gave the example in schools of like going on a field trip and suddenly we're, let's say, walking the whole loop of Harlan Camp with your grade 4 class. That could like be more activity than that kid was kind of expecting and could lead to some low blood sugars. Do you want me to keep yapping? Okay. So high blood sugars, just a little deeper dive. They're also known as hyperglycemia. There's no set range for high blood sugars. The healthy sugar range is between like 4 and 10 most of the time. Obviously, they're going to pop up a little bit. Even with like really perfect diabetes control, they can sometimes sneak up a little bit and drop down a little bit. So yeah, there's no like set range for high blood sugars, but like being above 10, and especially, and then also feeling symptoms too. So high blood sugar symptoms might be like having a headache or having dry mouth, feeling really thirsty, so drinking a ton of water, or feeling like you need to drink a ton of water. And then on the flip side of that would be frequent urination. So if you find that you're peeing a whole bunch out of nowhere, and that might be a sign that you've got some blood sugars that are creeping up there on you. Same with blurred vision. So when our sugars are really high, our eyesight can become affected because of the little tiny nerves that are in our eyes, the little tiny blood vessels. Also, same with weakness and nausea. So you can kind of just start feeling pretty yucky if your sugars are really high. So as far as treating high blood sugars, we would like advise everybody to stay calm. Don't panic because that can cause your sugars to rise because we know stress causes that, right? If sugars are ever reading high, like on your meter here, that is like a sign that to go seek medical attention probably. Because when like our blood sugar meters, they can only read so high. They can only tell to a certain point, and then they're inaccurate after a certain point. So they'll just say high, the little HI on your screen, or HIGH, and we don't know if your sugars are like in the 30s or if they're in the 60s, 70s, and that's where like problems can really happen. But in general, I guess if you tested and they were higher than normal, let's say 20 or something, it would be a good idea to stay calm. Get your meter out, make sure you're testing regularly, drinking a big glass of water, and then going on like a light walk. So we wouldn't want anybody doing like a whole bunch of strenuous exercise to try to bring their sugars down, but just doing like a light bit of walking or physical activity is a good plan. If this happens before a meal, this would be a good time to like choose low carb options at your next meal or snack. So let's say you test your sugars at 11:30 here and they were like 25, which is too high and higher than normal for you. You're not feeling very good. Maybe at lunch you would have the soup, maybe skip the bannock or skip the bun to go with it or the sandwich, and try to drink some water and go for a light walk.
Okay, so low blood sugar, many of you will know that as hypoglycemia. That's when it drops below 4. People can feel tired, dizzy, shaky, sweaty, anxious. They can still feel nauseous with this one too, tingly. If it was in the night, you might end up with nightmares or woken suddenly. If they go too low, you can become unconscious, so it is important that we treat it and that we know about it. Some of the general population will still have that. My husband says I do get that hangry. So it's your body's sign that you should eat. You're hungry, and yeah, some people do get irritable. Next. So to treat a low sugar, it can be treated a few different ways. It can be treated with Dex-4 tabs. You have to buy those at the pharmacy. They do taste a little bit chalky, but that's on purpose so that kids don't just take your stash and eat it as a treat. You can use a tablespoon of honey or a tablespoon of sugar. If you're using the sugar, you should dissolve it in water first so you can swallow it down quickly. You can use 2/3 of a cup of pop or juice, 2 rolls of those rocket candies, 6 lifesavers, and then Alicia added there, which is a good point, you don't want anything that has fat or protein, like a chocolate bar. I'll have so many people say, oh, I had a pastry, or oh, I had a chocolate bar, but that can take a while for your stomach to have to break the fat away from the sugar, and then the sugar to be digested into the blood. So you want to do something fast. You want to do a fast-acting sugar for this.
This is a little bit more detailed, but basically you would treat with what Tanya mentioned. You wait 15 minutes and then you would check again. If it's still less than 4, then you would treat again, and you do that on repeat until it's above 4. So every 15 minutes checking by blood. If your next meal is within an hour, you would just eat the meal and make sure it has some protein and carb and fat in it and be kind of balanced. If you aren't eating for over an hour, you would have a snack that has carbohydrates, so crackers with protein like cheese or like a peanut butter sandwich. So yeah, you just have to keep repeating till it's above 4, because if you're someone on insulin or medications that make your sugar go lower, it will still be acting in the background, bringing that down, so you have to make sure you keep treating till you're safely above. All right, screening and treatment. I think you better do this one. You made these ones great.
Oh, this is bad. Okay, so if you have any risk factors, and I think we go over them later, but one of them is being Indigenous. So if you have that and other concerns, it's a good idea to get checked at the clinic. Adults over 40 in the diabetes guidelines, they say every 3 years, but with risk factors, it can be as often as every year. So don't be shy, come in, get checked, just find out, get a baseline, and go from there. And consider try to encourage all your family to do the same. So for children and adolescents, I won't go into huge detail because Alicia's gonna follow up with a study we did, but they could be screened as often as every 2 years. So with these following risk factors, so one risk factor can solely be being Indigenous, with another one just having a first-degree relative or being born to a mother that had diabetes. So that puts a lot of people in that category, so it's no harm in also getting checked and just going often. But then there's these other things called insulin resistance that can happen, and Alicia will go into the acanthosis nigricans. Hypertension means high blood pressure. Dyslipidemia is high fats in your blood, and that I think that term has actually been changed, but it's non-alcoholic fatty liver disease, just means fatty liver. Do you want to talk about the new term? Okay, so it's kind of disturbing, actually. I reviewed this morning again, but children can start this at the age of 8 if they haven't hit puberty. And then I think I lost a slide here. Yep. So if they've hit puberty and, oh yes, it's there. I just missed a little bit about it. And they have 2 risk factors and they're over the age of 10, then they can be screened every 2 years. Kelly already covered this. We are offering diabetes days for patients living with diabetes, so it's not for people getting tested. We really want to focus this day on making sure the people living with diabetes are getting a full yearly assessment that's really thorough. It might involve looking at their feet or renewing meds or really assessing them to see if any can be discontinued or a better one can be added, sending appropriate specialist referrals, making sure they've had their eye exam, getting them up to date on their immunizations. There's quite a few things we cover those days. They can see myself and a dietitian, so it's kind of like they get center stage that day. There are limited spots available. They're occurring on a monthly basis, and there is a lunch provided. Oh, and we want to say Dr. Oli Woli. She always says, hey, I can learn all these names in the community, and everyone, I'm okay with the Dr. O, but if you try it out, you might be able to say it. So It's Oli Woly is our Dr. O.
All right, well, now you know the answer to this, but we are seeing a rise in type 2 diabetes in youth in Onion Lake. Is this true or false? How many think it's true? Okay, everyone's hands are shooting up. So we'll go to the next slide. So it's true. You can skip to the next one, Kelly. So we did a bit of research in Onion Lake at Eagleview. We worked with the pediatric endocrinologist, Dr. Daphne Yao, from Saskatoon, with our diabetes team and Eagleview staff. And we did some education classes, talked about diabetes, risk factors for diabetes, healthy eating and activity, and the benefits. And then we did a screening day. We had parental consent, and youth were given the opportunity to be screened at the school. So out of all of the consents, which were probably over 100, we only had 23, but that's still better than 0. We had 23 youth participate. One student was omitted due to already having been diagnosed with type 2 diabetes. The study was measuring hemoglobin A1C using a dried blood spot test. So you can see in that picture, what we did was they did a finger poke, and then they had to put the blood onto the paper, and then it was sent away to Regina. The reason they wanted to do this test is to see if communities that don't have lab services would be able to utilize the dried blood spot test, say further up north, send in to Regina to get screened that way. We're lucky enough in Onion Lake we have lab, but this, if it shows it's useful, they could use it in other kind of communities. It shows a person's 3-month average blood sugar. That's what an A1C test is. So we found that 1 in 5 of grade 8 students that we screened were positive for type 2 diabetes. I started working in Onion Lake 21 years ago, and we had 0. At one point, we might have had 2 over a 15-year period, and now in the last, I'd say 5 years, we have seen a huge increase. The referrals are coming in, and we're getting kind of even bogged down. It's a lot more complex with youth. There's a lot of other family dynamics and things going on as well. So we were actually quite shocked at how high it was. So some were positive for diabetes and others for pre-diabetes. Like I mentioned, pre-diabetes is just sort of catching that a person's blood sugar isn't kind of at target. It's pre-diagnosis of diabetes. So you're showing a little bit of issues with bringing your sugars down, but not quite diagnosed with diabetes. But we can still intervene at pre-diabetes level. We can teach you how to have more balanced meals, things like that. I wanted to mention that over the Thanksgiving weekend, I was sort of looking at Facebook posts, and as dietitians, Ashley and I see so many people that mainly eat carbohydrate for their meal with a tiny amount of protein, 0 vegetables. Sometimes that can't be helped because access is hard to vegetables and fruit. But we'll talk about that tomorrow, food insecurity. But I wanted to mention when we're having meals and you have access to vegetables, like greens, carrots, anything that's not a potato or corn, it's good to try to add them in. Almost every picture I saw people post was bannock, potato, macaroni salad, potato salad, mashed potatoes, stuffing, and then turkey. There was 0 vegetables except for a bit of celery in the stuffing. All of those things minus the turkey make sugar in our blood. So even just a simple thing like changing your side servings, giving more vegetable options would be huge in your households. So if you can afford it and have access, that's one way you can help your family just start to kind of look at what you're putting on the plate. Sorry, I went off topic, but I didn't want to forget that. Okay, so things to think about and what to watch for. So symptoms of diabetes in youth, similar to an adult: increased thirst, increased urination or peeing, changes in vision, so the blurred vision Ashley mentioned, changes in weight, so we might see a loss or a gain. Often when someone's sugars are extremely high, they might actually lose weight. Their body's really struggling to, it starts to break down your body's stores of energy to feed itself, basically, and give itself energy. so you might see weight loss. Slow healing wounds, frequent infections, where the body can't heal itself. And this is the main one we wanted to mention. It's got a weird name, acanthosis nigricans. Acanthosis nigricans, has anyone ever seen, that picture in the bottom shows you what it looks like. It's a darkening of skin around the base of the neck, can be under the armpits, the groin, behind the knees, elbows, anywhere there's kind of a joint. If you see darkening like that, where you think they just need to scrub their neck clean, it's not usually dirtiness, it's showing an outward sign of insulin resistance. So even if you took your child, say your child had that on their neck, if you brought them in to get screened for diabetes, I just want to be clear that their blood sugar might look okay, but if we tested their insulin levels in their body, they would be through the roof. So I saw one girl, her A1C, that 3-month average was perfect. She had a A1C of 5%, which is awesome, but we tested her insulin levels and it was 350, which is insanely high. So we don't even have to do a test to know that this person in this picture has insulin resistance, which is kind of a precursor to diabetes. Does that make sense?
Yeah, and I just did want to add there, but you kind of covered it, is sometimes youth won't show any of those symptoms for a long time. So it's still important to get them checked if you have any sort of worries.
All right, so type 2 diabetes in youth is concerning. We see more youth being diagnosed, more health complications when diagnosed young. So what that means is, you've all heard of complications of diabetes. So when people have high sugars all of the time and they're not brought down to a healthy level, it starts to wreak havoc on all the body parts. So we have tiny vessels behind our eyes, the ends of our hands, our feet, our heart vessels. All of those different parts start to get affected, our nerves. We start to see damage in the body. The problem with having more youth diagnosed now is they're living longer with potential of having high sugars, and they find that their complications are more aggressive than adults. So it's actually really terrifying to me that we're seeing a rise, because we're going to have a lot of kids needing a lot of different things, like you might see people on dialysis, or I'm not saying that to scare people, but I want people to realize how serious it really is, because again, it's more aggressive than adults. Risk factors, Tanya mentioned already, but First Nations or Indigenous ethnicity is one risk factor. Parents or siblings with type 2, a mom who had diabetes during pregnancy, if a child is higher in body weight, if they already have high blood pressure, high cholesterol, dark patchy skin in the neck or groin like the acanthosis nigricans. We actually want to start screening more regularly in Onion Lake because of the study, so we have to start thinking of how we will do that. It's a lot of work, but we think we need to start doing regular checkups in grade 8 and maybe say 11, just to capture every student. All right, so what about drinks? Ashley mentioned we have a drink display back there. People are always shocked at how much sugar is in pop and juice. You noticed how we use that to treat a low sugar, so it's not something we should be drinking all the time. So you want to try offering toddlers and children water, milk. You can offer chocolate milk, but it has extra sugar, so we just try diluting it with regular milk. And then we limit fruit juice to half a cup max a day, so that's half of a juice box. I mean, we're not perfect, but if that can be kind of the max over time, that would be great. And then other drinks low in nutrients are Gatorade, Pop. What else? I think that's it for that. Another thing we were talking about is we need to start working as a community as a whole to start to address diabetes and do more preventative things. So in the schools, we try to get people to offer non-food items for rewards. So instead of doing like pizza parties, maybe we could do stickers. Sorry, that sounds lame, but something different, like think creatively. Lots of kids are smart, they have creative ideas, so trying to think of fun things that aren't dealing with food. Offer healthy fundraisers. You could do soup sales, you could do cookbook sales, craft sales, offering healthy foods or drinks in canteens. We have lists if you need them. And then offering healthy foods in breakfast and lunch programs. I know all of the cooks met with Ashley this year, I think, mostly, to go over their menus. And then role modeling by staff. I went one time to one of the schools to do a presentation on nutrition, and the teacher had actually just sent a student to get pop and chips for her at the store to bring back for her to eat while I did the presentation, and she paid them with candy. So I was like, well, this isn't really helping me with my talk, but so things like that, being aware of what you do, how it makes a difference. And then public events, hiring local caterers to offer balanced meals instead of KFC, pizza, and carb-loaded meals. Like I mentioned, the carb-loaded meals is just, every time I see it, I just think, oh, come on, where's the green, where's the orange? Especially if we can afford to feed people that may not have access to healthy foods at home, that's the time they can get good nutrients. So you want to give them the good stuff. Offer zero sugar drinks. Instead of regular pop, it should just be cut out completely. Do water, diet pop. Crystal Light is an artificial sweetener. They are safe in moderation. You might see things on TikTok or things that aren't real, but they've done tons of studies on them. They're safe. Obviously, they're not great. We don't think you should just fill up on diet pop, but it's the better alternative of the two. And then encouraging activity, including activity breaks. Like when we have our break here, we're gonna do some aerobics. Just kidding, we're not. Okay, and then at work, we want to try to have themed staff meals. We talked about this at work. Instead of doing potlucks where everyone brings a ton of food, maybe do a theme like tacos in a bag and someone brings different ingredients for that meal. When we see variety, we eat more. That's a proven fact. So if you see a bag of Skittles that are all different colors, you're gonna eat more than just one color. They've done studies on it, and it's the same for foods. If you see all those foods offered, you're gonna take a bit of everything. So you wanna make sure you're having, things, make it less so we're not eating as much. Encourage activity by doing walking meetings, stretch breaks. We used to have, I'm just saying this for our health director and associates, we used to have a 20-minute per day time for us to work out or do activity as staff. Some people do it during their lunch break, but they only eat for 10 minutes or 15, and that's really not great for eating habits either. So we would encourage, workplaces to try to give that back. It's a really great way to, in the afternoon, get your energy back. And then do healthy fundraisers again.
And it's for role modeling. And then I just want to say, as a student, I probably wouldn't be really motivated by the stickers if it was a big thing. So free time or exercise time or a fun event might also be something we could do.
I think this is we already talked about this, but being mindful of the foods you offer your kids and bring into the home. Avoiding body talk or negative self-talk is really important too. I know so many parents come in and want to lose weight, or they say, oh, I'm too big, or when you say that in front of your kids, it really starts to impact them. So just being aware of what you say really matters. And then prioritizing physical activity, trying to get the screens turned off is so important.
I want to say one thing that I thought of in here that we missed, and it was about sleep. So lots of people with diabetes get diagnosed with sleep apnea. But anytime we're not getting good quality of sleep, it can really increase inflammation in our body and rise our sugars. So again, if your spouse is saying that you snore or that you stop breathing when you're sleeping or anything like that, it's really important to have an assessment and have that checked into as well.
Do we do questions now, or we do have a video? It's a 15-minute video that we did during our research project, and we wanted the community to see it, so this is the perfect time for that. We're just waiting for the Bluetooth speaker to connect. Does anyone have any questions while we wait?
You talked about a little bit. Is it a hereditary diabetes, or is it all diet? Or what? I know you talked about it, but years ago I asked you guys, and you guys were on that. So
There is a hereditary component. We mentioned how gestational diabetes, or if a mom has diabetes in pregnancy as well, if her sugars are elevated throughout the pregnancy, can impact the infant to increase their risk of diabetes. We know that, well, Tanya's better at talking about this. I don't know if sorry.
Well, there is also a field of study called epigenetics, and everyone in this room will know about genetics. And so that's whether you're a carrier of a specific condition like diabetes. But then the epigenetics component is how long can we shut that gene off? Think of it like a light switch, just keep that diabetes off. And there's lots of different ways, but one of them, I think tomorrow Jolene will talk about, but breastfeeding is a really important way. It protects the mom and the baby. It protects the youth from developing diabetes. It helps the mom to lose weight. We take every opportunity to tell people that it takes a community. You want to support people that are going to breastfeed. You want to bring them water. You want to normalize it. You want to support them in any way you can. The other thing that I think does get missed with diabetes is lots of times, because it is food and it is activity and it's lifestyle, people carry guilt. But it is also, as you saw, a hormone imbalance, and we don't often refer to it as that, but it's important that we do. If someone has a thyroid condition and then they have to take a thyroid medication, they're on it for life and they never question it. But when someone has to go on insulin or use one of those weekly injectable incretins or gut hormones, they often are asking me, when can I go off it? And they feel like if they did something better that they could, but that is not always the case. So we need to make sure that we get rid of the shame and the blame of that and just do the best we can.
Yeah, we often see people drink tons of pop, but they may never develop diabetes. So they might not have the genetic risk factors that another person might have. So that's another example. Some just have a predisposition to developing it.
Check. You didn't answer my question.
Yes, there's a genetic component. And if you
Is it hereditary? I said.
Yeah, yes. Hereditary means it's a genetic.
You're still on a fence on that, or?
I do want, Tanya just mentioned, she talked about epigenetics. It just is kind of the study of genes and how it's affects the infant in utero. So one really cool thing we learned over the years is that a baby, so say you're having a baby and it's a girl, and her eggs are all formed while she's inside of her mom. So what that means is she's influencing her future grandchildren. Does that make sense? So if, not pregnant, but if I was, and there was a baby girl in my belly, all of her eggs that would be used to form babies later on are developed inside of my body. So I'm going to influence my own grandchildren, which sounds crazy, but by keeping your sugar under control, it decreases risk of even grandchildren developing it. And then breastfeeding drops your risk, the offspring or the baby's risk, by 50% of developing diabetes. So actually, I think it's one of the main ways we can prevent diabetes in the future. There's not a lot of ways prevention works, but breastfeeding, if we can get those rates up with Jolene now as our lactation consultant and doing all of her good stuff, then it'll be great because we'll see numbers start to drop.
Any other questions? Are we good? Anybody?
We have the video ready to go, I think, so we'll let Terry start it up, and it's 15 minutes long, and then we'll have our lunch break.
I'm Ashley DeBuscher. I'm a registered dietitian. I've been with the Onion Lake Health Center for the last almost a year now. My position was added to this already awesome, well-established team of the community health department at the Onion Lake Health Center as we discovered that there was an increased need for health professionals dedicated specifically to the youth of Onion Lake. We also have a school nurse who is now on board and working full-time. Both of these positions were added a bit in response to the increased rates of diabetes and other conditions we're now seeing in the youth. A big part of our role is also prevention too. So both her and I, we are able to be in the schools. We can go class to class and talk with kids about different topics to promote health and wellness within the student population, the youth of Onion Lake.
I'm a pediatric endocrinologist here in Saskatoon, practicing at Jim Pattison Children's Hospital. And so I see, I guess in terms of what that is, I see children with a variety of issues with hormones, and including diabetes as well. There's kind of different types of diabetes, right? But the biggest or the most common are type 1 and type 2. But in this case, we're actually looking really more at type 2 because that's the kind of type of diabetes that's becoming more and more prevalent among, more common among youth. And so in type 2 diabetes, that is really very, very rare in children who haven't started, haven't gone through puberty. So we kind of wanted to catch them where they would have kind of started to go through puberty or have gone through puberty, but not so late that we're kind of missing the boat a bit in terms of kind of catching things early. So that was kind of that trade-off between those factors.
It's recommended to screen younger now in high-risk groups, so it's really important because if it goes unnoticed, it can lead to short and long-term complications that can affect them through their life, so that's important.
So that's the big problem here. I don't know how to really initiate, the prevention. It has to come from top down, the leadership, and straight down. I don't think the health department could do it alone. We have to get everybody on board on it. That's the only, way I could think of, and it's going to be difficult to do that. When I was young, I was, raised with different kind of, substance, wild meat, wild berries, everything was wild. And at that time, that's how we survived, to get our own, substance for food. Nowadays, you don't do that. You buy it from the groceries, you buy it from confectionery stores, like our store. When I walk in there, it's all unhealthy food.
It starts from the home too. Like I said, it's teaching our children, our grandchildren, eating healthy foods instead of processed foods and all that. I know processed foods are really simple to make, but and like I said before, I think diabetes education in schools, especially the younger age. I grew up in a residential school. That's where I think I picked up my diabetes. It's because of not eating the right food. Like I said, residential school, it was just all processed food, nothing healthy, and we were forced to eat those foods.
So my mom was, I think she was diagnosed with diabetes when she got pregnant. I mean, I'm literally at risk, I guess. Just one being First Nation, two, it's familial. Yeah, but I think that's quite common for a lot, not even just Indigenous people. I think it's any persons who've been colonized and systemic displacement and such. So a disruption to your livelihood, I guess, would cause high rates of diabetes.
I'm not a diabetic, but I work with people that are diabetics, and I know what they go through, and that's my biggest fear. I wouldn't want to be one. It's scary to stay young. When I hear about a young child being a diabetic, it's, it hurts me. It hurts me to you know how kids are. They just want to eat whatever. But for some that have that, they have to really watch them, and they have to live with that for the rest of their lives.
Part of it is because of family history. So there is a genetic component to type 2 diabetes. So if your parents or grandparents had type 2 diabetes, then you are more likely to become type 2 diabetes yourself. Whereas type 1 is not so much linked to genetic, and that's something that is usually found in younger people, but we're starting to see more of the type 2 developing in younger people as well. And not just on reserve, we're seeing that everywhere actually. So what we found with our diabetes screening project that we did with grade 8s at Onion Lake, we found that 1 in 5 had either prediabetes or diabetes, so that's pretty high actually. That's it was a little bit unexpected for us. We knew there would be a risk, but we actually found probably a little bit higher than we had expected.
Honestly, I'm not even surprised by statistics like that. I think given people's like socioeconomic status, not everybody can get to Lloydminster for fresh produce, and oftentimes it's just the stores that you have, and that's things that are high in sugar. Those are very processed foods.
Basically, limited fruits and vegetables, just healthy foods in general in the community. Lots of people tend to eat carbohydrate as their main source of nutrition, and we know that it should be more balanced with protein and fruits and vegetables and healthier options, but there is limited access to a lot of people in the community. So maybe down the road we're trying to start a community garden. We've had community interest and are meeting with people for that, as well as maybe down the road a grocery store that has, relatively good prices for healthier foods, that type of thing.
So my roots are embedded in this community. What we do in education, I take it personal because I'm from here, and I always tell my staff, just remember, that's the future. That's the future of Onion Lake that we're working with, which is the child. And the 4 elements that we really talk about is mental, emotional, spiritual, physical aspect of a human being, of a nihil. And what they take in, not only just knowledge, but what they eat plays a big factor in the mindset. So when I was a principal at Chief Taylor, we done away with a lot of things because of diabetes. And what I mean by that is doing away with pop, even at concessions, not selling junk food. Diabetes has always been an issue in any First Nations. So in education, we're trying to educate the parent, because the parent is the one that buys the food and the parent is the one that cooks. But at the same time, a little off topic, we're trying to empower the child and to cook accordingly. And what I mean by accordingly is what is healthy.
The schools have done a good job of trying to get rid of pop and sweetened beverages in the schools. It's just a matter of maybe community events. I know that recently I've also noticed that a lot more water is being offered, which is another positive step. So over 20 years, public health measures take a long time to be noticed, I guess. And I've noticed positive changes in that regard as well. So having the whole community being involved in reducing barriers to healthy foods, instead of having even, things like fried chicken for a meal, a community meal that we're hosting something for, maybe trying to have more homemade foods and using local caterers would be helpful. Making sure there's veggies and fruits as an option, and definitely water instead of pop or juice.
And this isn't just for diabetes, it's just for being healthy in general. I think so some of the things would be really being as active as possible, right? So, and it doesn't have to be necessarily organized physical activity. People maybe think, oh, I gotta go to the gym and, lift weights or run on a treadmill. And I think it's just really being as active as possible, whether it's, instead of you kind of walk, a little bit further. So activity is, really a big deal, and certainly there are guidelines around how much activity, in terms of how many minutes per day of moderate to rigorous activity, but I think just anything that can be incorporated into, your life, fruits and vegetables, lean protein sources, lean meats.
Well, I think there's going to be some risk despite anything that you do to try and prevent it. There is going to be a certain number of people that do develop it just because of the genetic component, like I said, and the family history. But there are things you can do to try and lower the risk in terms of trying to do things that help you with healthy weights. So, and in a community, there's lots of things you can do, right from prenatal care, helping women gain not too much weight during pregnancy, supporting breastfeeding, things like that in that age, and then even into the school years and things like that, just really supporting initiatives that support healthy eating, active living for the youth in the community.
It can come much later, but signs of thirst, peeing frequently, tired or blurry vision can be later signs, but there's kind of warning signs that you can watch for in your child.
There is one that we see quite commonly in youth. It's a sign of insulin resistance. It's called acanthosis nigricans, and it's a darkening of the skin in certain areas. One common area would be around the neck, so the back of the neck, kind of around to the side, maybe the armpits, sometimes under the knees, that type of thing. And it's just a darkening of the skin. It almost looks like a person might have dirt or have a dirty neck, but it's people I know have actually tried scrubbing it and realized it's part of the skin, and that's just an outward sign of insulin resistance. So that's an early sign for us. Their blood sugar may appear normal on blood tests, but that doesn't mean that their insulin levels aren't excessively high. So that's a pre-diabetes sort of sign for us to know we should be maybe talking to the family about healthy eating and activity levels and sort of other signs and symptoms to watch for.
If you do have, or have a diagnosis of diabetes or pre-diabetes, there's a lot of things that are within your power to control and change. Even if it doesn't sort of make the problem go away, there's a lot of things that self-efficacy that you have within your power to do that. So I think it's trying to message that to the youth who have probably seen, and maybe heard a lot of negative things and there are, certainly health consequences that are quite, quite very serious if it does go untreated as well. But I think we wanted to try to change that narrative a little bit, for them going forward.
What gives me hope is having that positive self-esteem of who you are. So trying to empower the nation the best way you can and trying to lead by example is a step in the right direction. So other people will look at you and say, okay, he is making something out of nothing. And what I mean by that is diabetes. So that's how we're trying to think, because again, like I said, most of the time we assume the parent, due to lack of education, I guess, about diabetes, to them it's not going to happen to us anyways, that mindset. So we need to educate them.
Like, kids are so ready to learn these concepts that people don't think they have the capacity to learn. So education around food, pretty much, or the body in general.
We have to do more prevention, with the parents. They're the ones that feed the kids. So really, we have to really do more prevention.
That was that? Tanya, ladies, that was that? All right, give it up for that video there. Hey, thank you very much. The agenda says it's lunch. So, Vanessa, are we ready? All right, so at this moment, I'll get our very young elder to come up and pray. Hey, thank you very much, Leon. All right, so I guess everybody can get up and start feeding yourselves. Are we still live? We're still live? Okay. If you guys still want to come out, partake in our health forum, still lots of time to come and listen to our speakers, our presenters. And if you come now, soup and bannock, and win door prizes. Come on down, don't be shy. Y'all come back, okay? All right? Bye. Like I said, we have a lot of door prizes to give away. Make your way down here to the new round hall. We got lots of sponsors to mention here throughout the next few days. I'm going to read them out right now. RDS Laser, thank you. RBC Bank, Boundary Ford, All Nations Building Supplies, Treaty Governance, Onion Lake Pharmacy, Justin, Eagleview, Yellow Butterfly Creations, Ulmer Sevols, Nordsor, Chief Taylor, Cardinals Gas Bar, Matt Child Health, Macao Mall, Pewasinagon, Onion Lake Education, Jordan's Principal, Community Health, Sikat Scoots High School. Lots of door prizes. Like I said, we have Oilers tickets to give away, but that won't be till tomorrow. But we have a lot of good ones to give away also today. We have gas vouchers from Macao Mall, $50. You come today, you could win that. We got lots of blankets. We have Beat It stuff. We have gift certificates, gift cards. Come on down. We still have the afternoon with our forum, so don't be shy. Come on down. What else can I mention here? Tomorrow we will have Dr. Khan. He's from the province, leading doctor for First Nations regional, I think they call it regional doctor. So he'll be here to answer any kind of questions you have on vaccines, pandemics, anything you want to ask him. He knows it all. He knows everything. So he'll be here tomorrow. Alrighty, and for now, if you can hear me on the radio, if you're watching me live, come on down. If you can make it, tell your family members, your friends, your neighbors. We have lots of door prizes. Don't lose out. Come on down. All right, I'd like to welcome everybody back. Thanks for coming back. I'd like to thank the speakers from this morning. Active treatment, Kelly. Diabetes, Tanya, Alicia, Ashley. Hi, thank you very much. And thank you, Vanessa, if you can hear me. Thank you for the soup and bannock. Was the soup good, people? Let her hear it. Thank you very much. All right, so we're going to get back on the agenda here. So we have home care scheduled for 1 p.m. But before that, I am going to welcome a few staff members with our school dental. If you ladies are in the building, I am going to introduce you. All right, thank you very much. Oh, hey, for the elder, thank you. All right, so I'd like to introduce these three ladies. They work with the school dental here in Onion Lake. First of all, I'd like to introduce Lane Daniels, dental therapist. She's a Chief Taylor. Give it up for her. She's back here. All right, and then we have Tanis Swifto, dental therapist at Sigascoots High School. Nice to meet you. Welcome to Onion Lake. And then we have Rayjan Lehman. Are you in the building? Rayjan, she's back here. She's our dental therapist at Eagle View. Welcome to Onion Lake. Hey, good to have you here. All right, so getting back on the agenda, I would like to call up home care, and I'm assuming it's Desiree. Okay, the house mother, Muriel. You're up. Stomach, assisted living, you're up. And all get up at once. Okay, so we got assisted living that's going to be up here talking about their program. So if you guys want to listen up, all right, thank you.
Good afternoon. Hope everybody had a good meal. We're the home care team. Noreen is with me here. The little one. And Charisse at Timoyo. And that table there's Sandra, Desiree, Leanne, Lindsay, Shalane, and Raylene. We're here to talk about our program, the Home Care and Assisted Living Home Program. Home care is helping people help themselves, services for people of all ages, and it's mainly in their home. And we want to help people to be able to stay in their home longer and be with their loved ones as long as possible. We also work with other health service providers to get the needed care. Our stats, last year we saw 281 home care clients. 67 clients accessed palliative and end-of-life care services. 23 clients were under 18, and we put in 6,604 home care hours. We have 8 full-time nurses, 2 casual nurses, 3 full-time home health aides, and 2 casual health aides.
Good afternoon. I just wanted to talk a little bit about our home care program. Our home care, the actual home care program did not come into existence until maybe 92, right, Albert? Anyway, back then, the home care program, I know, back then, hello? Back then, the home care program was at the band office. It was they delivered the home care program from the band office. And home care was men and women going out to cut wood for the elders, to go wash walls for the elderly, and go help at wakes. That was home care back then, until the healthcare system got smart, and about 92, they wanted to coincide the home care program with the provincial home care program. We did that through Confederation of Tribal Nations. I was hired in 1992 to start the on-reserve home care program on 6 bands. That was Onion Lake, Thunderchild, Palmaker, Little Pine, Sodo, Moosomin, and Red Pheasant. And since then, it has evolved. Our home care program has evolved really, really tragically. Drastically. Because, and, oh, I'm just so nervous, I'm going to look this way. Anyway, I wanted to say that our home care program is a lot more evolved than the other home care programs in the Saskatchewan First Nations. Our home care program is, I've seen the Saskatchewan First Nations and I work there. So this home care program in Onion Lake is very evolved. And I just wanted to say that we could get the referrals from even the family and anybody that is concerned about their relative being by themselves, and that's where we step in. But I wanted to say we are not a hospital. We are not a 24-hour home care program yet. Maybe one day, but not now. We do some home care nursing. The ones that are really needed, we do on weekends. And sometimes we are on call for our palliative care clients. I just wanted everybody to know that we are not an active care program, like we're not a hospital. And I know even some of the community members and even the staff members don't know what home care is about. So this is what we wanted to talk to you about. A registered nurse assessor will do a home visit to do an assessment, and that's 3 of us now, myself, Raylene, and Leanne. And the assessment determines services required, and if you are eligible to have home care services, that's when we go and do the assessment and the case management. We gather the information from the client, the family, the doctors, and others. We review your health history. A physical assessment is done at that time. Appointments are made at that time for anybody, because some of our elders haven't had new glasses in 5 years. Some of them can't hear. So, we make those appointments for them. They haven't had a checkup for years, and they haven't had any dental work for years. So we follow up on that. We communicate with other providers, and that'll be their doctors or our medical staff at the clinic. And we do an assessment of their current needs. And we refer to OT, PT, palliative care, and we do all the phone calls while we are at the visit. Assessment and home safety assessment. We do all that, the home safety assessment on the first visit. We do the safety assessment of the surrounding area for the client's safety and for our safety. We do medical reconciliation and review that medical reconciliation as needed. It could be every 6 months, it could be a year. Medication management. We help with the medication management. We still do some DOT, but not really, because that's not one of the things that's in our policy. The medication management, we don't deliver or pick up meds for the clients. Mostly all of them have families to do that for them. We do a depression assessment, mental health assessment, skin pressure assessment, risk of falls assessment, and teaching where it's needed. We do geriatric assessments. Based on assessed needs, there is a plan for their care. Evaluation, documentation of clients' response to care, ordering equipment needed, and working with OT from Lloyd Hospital to coordinate these home assessments. Working with the hospital navigator, coordinating long-term care applications, family meetings, coordination of services by assigning healthcare aides, nursing. The review of care is every 6 to 12 months. Efficient use of resources, admissions, discharge planning. Care plans are continuously updated. Safety plan for staff providing the care.
Other things that we do at home care are it's provided in the home. We teach self-care, teaching family to help you care for yourself. Client advocate. We are huge on advocacy. I know as First Nations people, some of us or a lot of us have a hard time talking or speaking up for ourselves. And we're quiet or we're shy, and we're huge on advocacy. So that's a huge role we play in, because a lot of people unsure what to say, or if they have complications with their health and they don't know who to talk to or things like that, we're helpful with that. So gaining trust as a nurse, going into people's homes is huge, because we build that relationship with individuals and families. So it's helpful. With creating that relationship and trust, we open that barrier for individuals and the healthcare system by creating that trusting relationship to provide that client care relationship and providing the services they require to be healthy. And yeah, so we also do weekends on-call nursing based on urgent needs, this determined by the assessors. Assessors are the registered nurses. And yes, I'm an assessor also. We notify assessors if needs increases or decreases. Here's a picture of the home care team providing foot care clinics, which is held every month at the Log Church. So we have about 20 to 30 clients each month that come in, and we provide that foot care for them. Some get special services. We also provide drinks. It also brings the community members, our elders together, and have that social life, bring in social life together and spend time together, visit. It's good, yeah. We also provide that foot care in homes, bringing that health services to your home and feeling safe for the ones who need it and are unable to get up and go out other homes and mobilize to go places, because a lot of times there's some that cannot go places, go out, and it's difficult. So we meet them at their home where they're at, and special tools to use and Dremels that required for foot care, safe foot care. Other things that we do are ordering wound care supplies, ordering incontinence supplies, ordering medications as per doctor's orders. Takes a lot of time, and we monitor vital signs for therapeutic interventions, blood pressure, spot blood sugar levels, oxygen levels, temperature, weight. And something that's important for that is we inform the doctors of any complications that we see based on our findings, and report anything that needs to be looked at further for health assessments and diagnostics. Medication management, medication reconciliation. We also administer meds as per doctor's orders. So a lot of running around too, like going to pharmacy, getting, reporting to the doctor, going to x-ray, talking to the pharmacist. So a lot of collaboration we do in our community and outside with the hospitals to gather up a plan of care and deliver those services to our community members.
Also, part of home care nursing, we administer medications through intravenous, intramuscular, into the muscle, or subcutaneous under the skin. We also remove sutures. These are either staples or stitches that are post-op clients, and also we remove stitches from maternity clients, obstetrics. We also do palliative care nursing, end-of-life care nursing. We prepare medications. We teach family how to give the medications as well. We order oxygen for comfort and also other equipment that they may need, like hospital bed, a Saska pole, and other equipment, wheelchair. We also, part of wound care, we do have a wound vac that we use, and it's really helpful for those deep wounds. We also use Pico dressings. These are for the not so deep wounds. We also look after PICC lines that need to be monitored and cleaned. We change the dressing weekly. Also do nephrostomy line care, like doing the dressing weekly. We also provide colostomy care. And this is for clients that need that healing inside their bodies, and they have an ostomy outside their body where their waste is collected into a bag. And that's not, a lot of times it's not permanent, it's temporary. We have home support workers that sweep floors, mop floors, transport clients for foot care. On occasion, they deliver meds if family is not available. Part of home management is, according to the care plan, is washing dishes, laundry, meal prep, and they also help us for our palliative care clients that need personal care. We also have a whirlpool bath at the Elders Lodge, which for some clients, they really enjoy that, especially for people with arthritis. They rather enjoy that. You want to do that?
Okay. We do not replace care provided by the family. We are not a maid service. Our healthcare aides are not called maids. We are not taxi transportation services. That's where family comes in. We do not provide 24-hour care service. We are not medication delivery services. We do not administer medications without a doctor's order.
We don't have staff here from the assisted living home. Yes, we do. We have Shalane. Shalane is in the picture. She's the LPN that helps out at the assisted living home. She looks after the clients there. And Carmela is our medical office admin. We have one MOA, one full-time LPN, one full-time cook, 3 casual cooks, 4 full-time home health aide or personal care aides, and we have 7 personal care aides. Oh, that one's repeated. So our assisted living home has been in operation since 2001, I believe. During that time, I was finding elders alone, and there was one elder I found that was in the tub. Like, I was knocking on his door, and I could hear somebody calling, and I peeked my head in, and then he told me to come in. So where I found him was in the tub, and he had been stuck there for a while. And he said he was just stuck there an hour, but he was dry, like he was there longer. And this is when I approached Albert, and I asked Albert, can we have something, like, there was a building that was empty, and I asked him if we could have that building for our assisted living, and he said it was okay, and that's when we had our home. So we provide level 1 and 2. It's basically elders or anybody over 65 that is able to walk to the kitchen and do things for themselves. We have 10 beds. The LPN monitors vital signs. The personal care aides do that as well. And our cook does the meal service. The health aides do laundry. They also give the medication. And before anybody moves in there, we have to do an assessment. Here's a picture of our 2 elder residents there. These ones, they really enjoy doing things like this. And they always ask for wild meat. And once they get it, they get into action. They dig in, they cut, store, and they tell the cook how to cook it. And here's wild meat there again. They're just happy. Like, look at their faces. They're happy doing that. We also have bingo. We try and have it at least once a week. And they enjoy that too. Some of the residents, they like helping out, cutting potatoes and stuff like that, or doing dishes. They get bored, so that they enjoy doing that. They're not slaves. Once a month, we have birthday dinners for the staff and the residents, and they really enjoy that. And that's it. Thank you from assisted living home and home care staff.
Wake up. Any questions for the ladies? If not, thank you very much, ladies. Hi, hi. All right, so that was assisted living. Hello, hello, hello. That was assisted living. So now we take another break. See you in 15 minutes. Walk around, visit the booths. Enter your names. Win some door prizes later. So see you in 15 minutes. All right, welcome back, everybody. Check, check, check. All right, we're going to continue on with our program here. I think everybody's in the building. Check, check, check. Yeah. All right. All right, so one of our presenters is not here right now, but thank goodness we have our EHO from Paradise Hill. Shannon Imhoff is here. Give it up for Shannon. But before I get to her, I'm going to get her to get set up here. So I'm going to go in the back here, and I'm going to be talking to these booths back here. Yeah, so I'm at the first table here. I have Tracy McNabb and Tracy Zelani. So what exactly do you do at the health center? I've worked with you for 20 years. What do you do?
I mostly work in immunization programs, so I spend a lot of time in baby clinic immunizing them, and also go into the schools as well and do flu shots. So we're offering flu shots and COVID vaccine here today if anybody wants it. If not, we'll be offering it ongoing at the clinic. And there's some information here about when we have baby clinics and how to get a ride if you need it. And a little bit of information about measles, because if you've seen in the news, there's measles cases increasing across the country. So we want to make sure everybody's protected. You want to say what you do? Do you want more?
I want to do a sound check.
Oh, okay. And then at my table, we also have a little information about our pre and postnatal programs, because that's the other programs that I work mostly with. So some supports for our young moms that are pregnant and have new babies. So we can help with weight checks, answer questions. We have a lactation consultant now at the clinic. So that's a little bit about what's going on at our booth.
The other Tracy, what do you do?
So I'm harm reduction nurse. We give out Sharps containers. I do naloxone. We have HIV self-test kits that people can take home and test themselves. I also help with immunizations. That's why I'm sitting over here. We do follow up with dog bites, and I work closely with the STBBI nurses, and I will let them speak for themselves.
Hi, my name is Brandy Jimmy. I'm one of the sexual health RNs at the clinic, and Tammy Pitts, sitting beside me here, is the other sexual health nurse at the clinic as well. We do all things STBBIs, that's sexually transmitted bloodborne pathogens and infections. HIV, Hep B, C, syphilis, chlamydia, gonorrhea. We offer the testing and the treatment for that. So you don't need to go and see a doctor to be tested and treated for STIs, as myself and Tammy can do all of that ourselves. I also do a bit of outreach, so I go out on home visits and I go and locate those hard to find clients and offer testing and treatment at the home or in the vehicle as well. We do education in the schools, at the treatment and detox facility, and where anyone else requests us to do presentations, we provide education as well. We try to do a yearly community-wide testing day as well. So we offer a lot of incentives. We are planning to have one in March next year, so keep a lookout for our poster, and it's open to anyone ages 16 and up.
Thank you very much, Brandy. Tammy? Fine then. Hello, ladies, the new girls in town. How are you? Wonderful. All right, what do you girls do? Where are you guys located? What do you do?
Absolutely, thank you. So everyone, we are the school dental therapists, and we are a part of the school dental program. Part of what we can do for your community is in the schools we have consent forms that go out. Once they're signed, we have authorization to do exams on your children. We can do referrals such as ortho, or if the child needs general surgery for dental work. We do fillings, we can do extractions. A lot of our treatment is done, and it's a funded program, so it's not using your own benefits. So it's really great throughout the year. We do some prevention services with fluoride. We have our COES program. So if they're not old enough to be in the schools, we have screenings for these children, a lot of oral health education, which is very important. And so a lot of what our display is about today is eruption sequences, symptoms that you want to look out for when your children are teething. And we have some fun information, little books and stuff on how to properly brush your teeth and tend to your child's teeth, and just about how important oral health is as a total. So there's 5 of us, 5 dental therapists, and 1 hygienist. She's dually trained, and so we're at all the schools in Onion Lake, and there's also an office for prenatal screenings at the health center. Go dental health.
Thank you very much. Now we know. What do you do? I know you were talking all morning about yourself, but what do you actually do at work?
All right, well, there are 2 of us, and 1 is hiding. First of all, the student is right here. We sometimes take nutrition students from...
She's not hiding, she's that short.
She's pretty short. We take nutrition students and kidnap them for 6 weeks, and they learn the ropes from Ashley and I for dietetics. So Tara is from Lloydminster. She will become a dietitian in 2026 if we pass her, which we will. And I'm the adult and infant dietitian now. It used to be just me, but we hired Ashley on full-time, so she does children and youth nutrition counseling. We do individual counseling, group counseling. I teach food safety for certification. We do the Fresh Food Box program. We are right now helping with the food bank. We have a vision for a food hub, which we'll talk about tomorrow. Prenatal, postnatal classes. When I have time, I do infant feeding classes. What else do I do? I don't know, lots of random things. And diabetes is the main thing I would say, but lots of different outreach programs. We partner with prevention a lot too. That is all. Ashley is in the schools. She's the one who you'll see in the schools most of the time.
Thank you very much. I don't know who they are. What do you guys do? Where are you from?
We can answer those questions. I'm Nicole Robertson, and I'm the Director of Programs and Services at Midwest Family Connections. And with me is Avery, one of our new program facilitators. We offer a continuum of supports and services for families, parents, and caregivers, from our community-based programs to home-based programs to our specialized services. So for community-based programs, they're welcome. Anyone is welcome. We have a location in Lloydminster. We're in the basement of the Prairie North Health Building. We have an indoor playground that has drop-in times 5 days a week, so from Tuesdays to Saturdays. It can be found in our program guide. We also offer different parent education topics. Virtually, we're going to be offering the Positive Solutions for Family series. So it starts next Wednesday. It runs, my phone just turned off, I think 1:30 to 2:30 in the afternoon. So families can join virtually from anywhere and just learn more about how to understand their child's behavior, and then how to respond to it, and then how to navigate challenging behavior as well. Then we also offer home-based services. So here, like, we have 3 program facilitators who come out to Onion Lake and they work with families one-on-one in their homes around child development, family dynamics, and community connections. And so we can support families whose children are 0 to 18 around those 3 pillars. We do ages and stages questionnaires for families who are either curious or concerned about their child's development. We can help them with strategies in the home to implement so that they can support their child's everyday growth through their regular routines. And just answer questions, things like, bedtime's really challenging, what can we do to make it easier? So we can help them kind of come up with strategies. We're family-centered, so very much recognize families are the experts in their lives, and we're just there to help them navigate the journey. And then we use a strength-based approach as well. So recognizing every family has their own unique strengths, we're just there to help them see them and then utilize them to help them achieve their goals. I think that's about all I'll say about what we do, but if anyone has questions, they're welcome to reach out and connect.
Thank you, ladies. All right. And you guys, what do you do? What department is this? All right. I thought you were the boss. Who's the boss? Which one? Which one's the boss? This one? She's bossy, but she's the boss. Okay.
This is Onion Lake Jordan's principal. I'm Barb. I'm the coordinator of Jordan's principal, and this is Lori, my intake worker. And I don't know where my other 2 took off to. Alyssa's over there. And Shannon. She disappeared. Okay, what is Jordan's principle? Jordan's principle is a legal rule named in memory of Jordan River Anderson, a First Nations child from Norway House in Manitoba. He was born with complex medical needs, and Jordan spent more than 2 years in the hospital waiting to leave. While the province of Manitoba and the federal government argued over who should pay for his home care that would have been paid for immediately had Jordan not been First Nations. Jordan died in a hospital at the age of 5 years old, never having spent a day in a family home. And today, Jordan's principle is a legal obligation, which means it has no end date, while programs and initiatives to support it may only exist for short periods of time. Jordan's principle will always be there. So Jordan's principle will support First Nations children for generations to come. And what is covered under Jordan's principle? Any service, support, or item a First Nations child needs. Multiple requests can be made for each child or group of children. And some of these examples are respite, mental health, OT, physiotherapy, medical supplies and services, special education supports and services, and dental and medications. So
Thank you very much. Hey, hey. All right, so those are all the booths. These guys are hiding. Where are they? FASD Awareness Day. FASD. All right. Those girls right there? But you're the spokesperson. Okay.
My name is Nicole. I'm with the Mad Child Health Program. I have Marina, who's the LPN, Jan Taylor, and Deanna Waskiewicz are home visitors. Shelly is the FASD support worker. A little bit about our program. We work with prenatals and we do postnatal care. We work closely with Jolene, the lactation consultant, the community health nurses, Alicia, the dietitian. Who else do we work with? The broad goal of Maternal Child Health Program is to improve health outcomes for pregnant women and families with young children so that all children and parents reach their lifetime developmental potential. Our focus is on mind, body, and spirit to build on the strengths and capabilities of pregnant women and families within the context of their communities and cultures. We transport clients to appointments, ultrasounds to ensure they get the proper prenatal care. Health promotion, health teaching, stuff like that. That's it. Thank you.
Thank you very much. Hey, hey. Okay, give it up to all the tables in the hall here. Like I said, our next presenter is from Paradise Hill, our EHO. One over there. Okay. Sorry, I didn't see you. Okay, who's your spokesperson here? Somebody probably hiding behind her? You? All right.
Hi, this is Onion Lake EMS. We operate 24/7. Our number is 911. We go to emergencies. Woo!
That's it? All right. Thank you very much, EMS. Give it up for EMS. Short and sweet. Hey, hey. All right, so I am the water quality monitor tech water boy. And I have two bosses. She's one of them, Shannon Emhoff and Pam Martins. And my wife, three bosses, sorry. But anyway, Shannon works for Health Canada. I know you'll introduce yourself here, but with Shannon here, I'd like to acknowledge Vernon. Tell him what kind of award he got and why.
Okay, thanks for having me. My name's Shannon Imhoff. I'm the Environmental Public Health Officer for Onion Lake. I work for Indigenous Service Canada, First Nation Inuit Health. A little closer. Can everyone hear me? Okay. So I'll tell you a little bit about what I do in a minute, and I have a video about what I do. But I just want to point out and acknowledge that Vernon Lewis, the water treatment operator in Onion Lake, recently was awarded a national award for his dedication and service to water treatment in First Nation community. So it's a pretty amazing award that someone from our community has been chosen to receive, because he's worked for a lot of years to ensure the water in Onion Lake is as good as he can make it. And now the water in Onion Lake, with the recent upgrades to the water treatment plant, is very, very good. Okay, yeah, so yay, Vernon. Okay, so I would like to just share a video that I made to we made this for our department just to try to encourage people to go into the field of environmental public health and do my job, because there's not very many of us around and we're hard to find, and there's even fewer people wanting to go and do this job. So please enjoy a little bit about what I do every day, some days, and I will give you a little bit of more information after. Safety in everything that we do and everything that we look at. It's our job to ensure.
Disconnected. Power off. Breakaway ready to pair.
Sorry about this. Yeah, no worries, no worries.
Connected.
While we're waiting, I'll just elaborate a little bit on what I do in community. So when I'm in community, there's a variety of things that we do. Is it working or no?
Disconnected.
Okay, just give me a nod or whatever when you're ready and I'll. So some of the things I do drinking water quality. So whenever there's a water advisory or something like that in community, that comes from me in my office. Or we also do sewage inspections, public building inspections.
Breakaway ready to pair.
I inspect all the public
Connected.
Buildings in community for health
Speakers
and safety.
paired.
We do food safety. Do job to help people. Here we go. Okay, I'll finish in a minute. Watch the video. Live in a safe environment, and when people get sick, we can try to help them determine where they're getting sick from and help them live a better life and have better health. My job is different every day. I start with having a coffee in the morning, doing my morning chores that I have to do at home before I get ready to head off to work. Check my emails, any phone messages I might have, see if there's anything urgent that I have to address or go look at. Then I'll go and pack all the equipment that I need for my visit in the vehicle, and then I hit the road. We do a little bit of everything. Water testing,
water sampling, pest infestation investigations, food inspection, health and safety, indoor air quality, communicable disease investigation. Some of the challenges with being an environmental public health officer would be sometimes you go out and do your work and the situations you see are hard. And when you're advocating to try to help people have better health and life, then sometimes you feel like you're not getting anywhere, but you just have to keep going because every little bit helps. As an environmental public health officer, I find lots of fulfillment for myself in my job every day, just with the work that I do, and I find that that's important for me to live a happy, successful life. If you're considering becoming an environmental public health officer, you need to be compassionate, you need to be resilient, flexible, reliable, adaptable, you need to be a good problem solver. The list of traits is endless. We are always in need of environmental public health officers, so if you're considering a career in this field, do it. There's no better time than now.
Check, check.
Thanks. So, like I said, that was kind of like a recruitment plug to, go be an EPA show. There's lots of grants for students that want to pursue that field, and all the information is available on the Government of Canada website. But back to what I do when I'm in community. So food inspections, we do housing inspection. Eugene and I do a lot of houses, go see a lot of people's houses in the lake, looking at like mold issues, cockroach issues, things like that. So that's one of the things I do when I'm out here. I mentioned water safety. We ensure the drinking water quality is water's safe to drink and there's no contaminants in the water. So I do chemical monitoring of the drinking water every 9 months just to ensure that there's nothing coming down the river that's getting into the water and community that could harm people. Eugene is very, very good at getting all of the bacteriological tests done. We couldn't do it without him. He's so great here in community to keep an eye on the bacteriological water quality and make sure there's no contamination in the water. It's pretty awesome. Thanks. You don't leave, stay. Okay, thank you. So, yeah, Eugene's great. Don't leave. Okay. Then other things we do is I sometimes help with communicable disease investigations, especially enteric diseases, like if people think they got food poisoning from like the restaurant or things like that, then I can go there and have a look and see what's going on. I also do infection control training for janitorial staff, custodians, things like that. Typically that's organized through Onion Lake Enterprises or the Health Center. What else do we do? Food safety training, but Alicia out here does lots of that for us, so I don't actually have to teach it out here because Alicia teaches it on a regular basis out here. But in other communities, I'm the one that teaches it because they don't have a dietitian that teaches it for them. I go to more than just Onion Lake. I go to a few other First Nations also, so I have to divide my time between all the communities I have to go to. Right now, because we're short-staffed, I'm going to about 8 communities, so I've been pretty busy being all over the place. And not all the communities are really close. Some of them are 3 or 4 hour drive just to get over there. So you try to make the most of your time when you get out there. So sorry I don't have a better presentation. I'm kind of just on the fly, not really prepared for this. But if you have any questions, just let me know. I can answer some questions. And if you want to access any environmental health services like
you want to request an inspection or something like that, all those go through the health center. So you just have to contact the health center and they can get your name on the list and we can arrange to, you know, have a look at your house or whatever is going on. Okay?
All right. Do you have any questions for Shannon? Health issues like, say, mold, chlorine levels, whatever? Any questions concerning that? Anybody?
Crickets.
We're all good?
Yeah. And I mean, I know sometimes you don't want to ask questions in front of other people, and that's okay. But my contact information is available at the health center if you have like a specific question about cockroaches or something like that. I also do pest identification for people that, you know, you find a bug in your house and you don't know what it is. So, you know, you can put it in like a pill bottle and take it, drop it at the health center, and I can have a look at it. Okay? Yeah. If you have questions for me, my info is at the health center.
All righty. Going once, going twice. Sold. You're sold.
What a buy.
What a buy. Okay. All right. Thank you very much, Shannon. Yeah, so thanks for helping us out here. One of our presenters did not show up, so that was going to be for mental health. So we will now go into the door prizes and wrap up. So Misty, how do you want to do this? You on the mic over there? Me come over there?
Hello, okay, there we go.
All right, so we'll be doing the door prizes now. So like I said on air that you had to be here to win, so you were given a ticket, so here we go. And it says a wrap up there. What are we doing? Are we doing wrap up after this? But what is wrap up? Who's going to? I'm going to do the wrap up. Okay. You want me to wrap? Wrap it up. Okay. All right. So. All right. Okay. So, like the pink ones. They were for the booths over there. We'll do one of each, a pink one, and then you have a blue ticket. And I'll be calling out your ticket number here. So first one we'll do, is there a blue ticket on that? Okay. All right, so the first bag will be going out to Brian Misto. Hey. All right, so now where's all the, let's do the tickets. Let's go back and forth like this. Ticket, pink, ticket. All right, now we're going to be giving out a blanket, a throw. Ticket number 018. 018. It's a blue ticket. Should only be one blue ticket. 018. All right. Let me see. You're a winner. There you go. Give it to that lady there. Okay, now we'll go back to the pink one. That's for the boots over there. This is for Okay, these are for work gloves donated by North Shore Tire, our neighbors to the south. And that comes with something else, or? And a hoodie donated by Chief Taylor, and a buck swather donated by, Health, all right. This one goes to Nicole Alexan Expo? What's Expo? EPCO. What is that? That's your last name? Okay, all right. Nicole Alexan, congratulations. Do you have a man for those gloves? Okay, just making sure. All right, now a blue ticket. This is an electric toothbrush, 007. 007. All right, looks like we have a winner. All right, come and see the ladies over here. Okay, now back to a pink one. This is a native design coffee mug. If I knew who was donating these, I would say, but I don't have it in front of me here. Tanis Waskiewicz. Tanis Waskiewicz. She was here earlier. All right, okay, she left the building, but we'll keep that. Okay, blue ticket one. All right, this nice, beautiful purse. Ticket number 031. 031. This would be a non-employee. All right, so we'll get to keep the tickets on the prize, and you want to redraw? All right, okay, they're going to redraw. It's for the same one. Blue ticket, ticket number 003. 003. Yay, we got a winner over here. All right. And here's another one. Items donated by North Shore Tire. Looks good on you, buddy. Looks good. Wear it proudly. We have a cap, mitts, and a bunny hug. That one will go to Ivy Hool. Ivy Hool. Congratulations. Thanks for coming. Oh boy. Okay, now for a blue ticket. This is a sign, a welcome sign. It was made by probably Alicia's sister, right? And what's the name of that company? Yeah. Yellow Butterfly Cree. 033. 033. 033. Do I have a winner? 033. We got a winner. All right. Okay. Okay, now we'll do. Okay, and this one will be a gift bag, swag bag, I guess. This one will go to Aisa. Huh? Aisa. All right, there's no last name. Huh? Bull? Ah, Isa Bull. Okay. Congratulations. Yeah. All right. Okay. All right. What do you have next? All right. Here's a nice one. This is a Polaroid camera donated by Onion Lake Lands Department. It's a camera, and it'll give you a photo right away. And the ticket number is 2005. 2005. And that's our cameraman. Congratulations, sir. All right, yep, that's the one. There you go. Congratulations. All right, now a pink one, a swag bag, I guess, whatever. This one will go to Aikisha LaRock. She left? All right, okay, let's move on to the next one. We're done for now? For today? Because we're doing a wrap-up right after yeah, isn't it? Yeah, we're done. Okay, give us a few minutes. We'll gather up some more here. So don't leave. Don't leave. Don't leave. So we'll put a few more things together here. Okay, from here on, we're going to do mostly the blue tickets. Okay, this next one is a Keurig coffee machine donated by Cardinals Gas Bar. Ticket number 029. 029. Was that?
My Keurig broke this morning.
Oh, right on. There you go. Ivy Hole. All right, so, okay, we got a blanket and a nice coffee cup with something inside. What is that? Socks? Shorts? What is that? Oh, gloves. And a gift card. Oh, what does it say on the gift card? Tim Hortons gift card, and there's another one behind there, isn't there? Oh, okay, and a Tim Hortons gift card, ticket number 009. 009. Do we have a winner? Going once, going twice, redraw. All right. Same prize, going to 032. 032. 032. All right, okay, redraw. All right, 034. 034. Shannon, did you get a ticket? How come you didn't win yet? Just kidding. Okay, let's do a pink one. We know those, they're here. Okay, the same prize, a blanket, coffee cup, and a Timmy's card will go to Stephanie Agula. Stephanie Agula. Is that how you say it? Ukwala. Okay. Stephanie Ukwala. Yeah, this one and that one. There we go. Congratulations. Okay, they're going to join in into the door prizes. Well, Lenny, we've been here all day. And now you show up. Wow. So, do they get 1, 2, 3, 4, 5 tickets? Okay, 5 tickets to them. Okay, let's do a pink one. Where's Cheryl? Where's our Cheryl here? Okay, well. Yeah. Go grab it. Well, Lenny, we want to go home. All right, okay, this next prize is a computer sleeve. What is a computer sleeve? Laptop case. All right. Okay, that one goes to Ernie Belly. Ernie Belly. Come on down. All right, let's do another pink one. Yeah. Okay. Grab us something over there, Ellie. There you go, sir. All right, this next one will be a pink one. This one is an air compressor donated by Many Nations. That one goes to Deanna Waskiewicz. Deanna, come on down. Hey. You drive a Chev, right? You'll need that. It's a Chevy pump. Yeah. You're welcome. All right, okay. Next one, what is that? Okay, booster cables donated by Many Nations. Ticket number 014. 014. Zero 14. Nobody? Okay. Next one. Okay. Booster cables again. 025. 025. 025. Once, twice. Okay, let's do another one. All right. 024. 024. 024. Nobody? Okay, let's do another one. Okay. 039. 039. Yeah, Lenny Wolf. You had a plan. You had a plan. There you go. What do you drive? Huh? What do you drive? Dodge? You need them. You'll need them. Okay. Okay, in this bag I have a nice cap from North Shore, water bottle, gloves, and lots of stuff. This one goes to Sayana Waskiewicz. Yeah. Do the dance. Come on, do the dance. The EMS, it's called, the EMS. There you go. Congratulations, ma'am. All right. This one is a $50 voucher, goes towards Macao Mall. On the mall, not the gas one, the grocery store. And that one will go to 037. 037. Yep, they had a plan. They had a plan. It's them again. He said, let's go late, we'll cash in. We'll win everything. Okay, let's see. Does it match? All right, okay. You can take that to them. Thank you very much. All right, okay. What else we got? We're done till tomorrow? All right. We're done till tomorrow, so hey, give it up for all the winners. Hey, thank you very much. And we'll be back here tomorrow, same time, 10 a.m. And hopefully more people show up in person. We have a lot of door prizes over there, lots of big prizes to give away tomorrow. So, and everybody else that's here in the building, thank you for all coming and showing up. Hey, we'll see you tomorrow. Hey.